My Heller experience was tremendous. I finished my doctorate in 2009. And I think one of the best things that Heller did for me was allow me to collaborate with a diverse group of people, and diversity in a lot of ways. And particularly important for me professionally is that their training was different from my own training. So I was working with people who were trained in public health, like I was, as well as people who had policy training before they came to Heller, economists, people who cared deeply about numbers data as well as stories data, and who cared about a broad range of issues, from children's health to things that affect families, to a deep and shared interest in social justice and promoting equity that cross-cut the different types of training and issues that we cared about. I was in the Children, Youth, and Families concentration, which was a great place for me to land because although my training was in public health, I was much closer to both issues of children's health and being able to apply what I cared about in a broader range of tools and skills. And so I loved the fact that my PhD training allowed me to go deeper into methods, both data methods and policy methods, and also allowed me to work with people who cared about children and families in communities in a really broad way, which allowed me then and allows me now to think about any issue that I care about as the ripple effects that it has to other issues of children's health, family health, and community health. And I think that when we're considering knowledge advancing social justice and promoting social justice, it's impossible to make a difference if we're thinking in silos. And so my training at Heller has allowed me to practice thinking and working in an applied way, in a cross-cutting, outside of silos kind of a way.